Hi, this is Markeitha and welcome to Healthy Living. You can reach me at healthyliving.company, and at my website there's several things that are there. I have several products. I have Keitha's gumbo, I have Keitha's egg toast. Also, the gumbo comes with hot water, cornbread, and rice. So you have to send me a message if you want it fresh. You can send it at my site, or you can contact me here at the Next Level Studios at 310-549-1113, 310-549-1113. Now, the producer of the show is T-Jams. That's T-J-A-M-Z. And his website is tjamsmusic.com. There you can listen to a whole list of songs he has produced. You can write lyrics to it and send him back, send him messages. You can also contact him here at the Next Level Studios at 310-549-1113, 310-549-1113. Now, TGM also does websites. Now, we're going to talk about the coronavirus update with the vaccines and also some reopening tips. Now, I don't really agree with them all, but these are some tips, and I'm going to give you guys a suggestion so you can stay safe, okay? Now, let's go to the current statistics right now, the numbers. I get it from the World of Meter website. As of today, we have around the world, we have 120,306,698. Now, deaths, 2,662,730. Now, there are several million that have recovered. There are 96,851,321. Now, those are the ones that have recovered. Now, let's go through the largest number. The U.S. has the largest deaths and cases. The cases are 30,055,971. The deaths, wow, we passed that 500 mark. 540,728. The second leader is Brazil. Brazil is the second largest. They have in cases, they have 11,439,250. Now, deaths, they have 277,216. Now, we just had a terrible anniversary on Thursday, March 11th. It's when the World Health Organization announced that we have a pandemic, meaning worldwide, with this coronavirus. It started in December 2019, and it was in China from Wuhan territory, and now it's across the world. We have 219 countries and territories. Now, what is the coronavirus? I think everybody know about now. The Nova is new, and the coronavirus is the SARS-CoV-2. It's a severe acute respiratory syndrome virus. It's a beta coronavirus. It's similar to the MERS coronavirus, which is the Middle Eastern Respiratory Syndrome. They all originated from bats. Now, in February of this year, the American Health Organization went into China to do an investigation to try to pinpoint how this virus got out of control. They still said that it's possible that it could have been accidentally released from labs, but then also it could be caused by bats. So that's an ongoing investigation that they're doing in Wuhan, China. We thought initially it was linked to live animal markets, but then it started going from person to person. So now it's person to person instead of animal to person. But we know now that it goes back and forth, and this is how we get variants. It goes from the human to the animal, and the animal back to the human. So this is how a lot of the variances occur. Now, the symptoms, there is a wide variance of the different types of symptoms that you can have. It could be mild, it could be like flu symptoms. So please, anyone who has these symptoms, don't chalk it off as the flu. Check with your doctor. It's fever, anything 100.4 or higher, fatigue, cough, shortness of breath, chills, repeated violent shakes. And they say it's very painful, those particular shakes. Headaches, muscle and body aches, sore throat, nausea, vomiting, diarrhea, congestion, runny nose, hiccups as well. They say you can have hiccups for at least a week or so before you even finally realize you have the coronavirus. So also new loss of taste and smell. So thus a lot of symptoms. So don't chalk that off to the flu. Make sure you contact your doctor. COVID can cause more severe illness, which causes some emergency warning signs. Like, this is when you call 911 when you have trouble breathing, persistent pain and pressure, like someone's sitting on your chest, but they're not actually sitting on it. New confusion, bluish, purple, and sometimes in darker skin, they have grayish of colors on their lips and their face. Now, who's vulnerable? It used to be 65 and older with the different type of medical diagnosis, but everyone can be impacted, including infants. So everyone has to be more vigilant. It's not just for them. It tends to be the older population that has the more serious condition that gets them admitted to ICU and then possibly get on a ventilator and possibly have an increased opportunity for death, and that's what we're trying to prevent. Some of the underlying conditions, they include heart diseases, stroke. Remember, I did a show about 2 or 3 shows ago on strokes, that COVID has increased the chances of you getting clots, so then you have strokes. So you have to really be mindful of that and respond right away. You don't want to wait several hours, because then you can have permanent damage or you can possibly die. So if anyone is having drooping or blurred speech, or their limbs or legs are not moving, a serious change, then you need to call 911 and make they're resistant. Also, hypertension, there's chronic respiratory lung disease, asthma. Watch your young children, because they tend to turn very severely ill very quickly because of their asthma symptoms. They can be playing around. If you see them suddenly stop, kids don't stop. They don't typically get tired. So watch your child. If your child is breathing like they're working hard, normally you don't see them breathing. But if they have these chest muscles and the shoulders are going, that means that's a lot of effort, and that means they're having shortness of breath. So watch your children very closely. There are cases where they have died quickly. So don't wait. If your children have symptoms, contact your doctor right away. But if there's breathing problems, take them into the ER. Also, for the adults, there's COPD and chronic kidney disease. The sickle cell anemia is also a risk. Liver disease, cancer, autoimmune suppressive diseases like HIV, leukemia, lupus, sarcoidosis, cancer, post-chemotherapy treatment. It increases your chances because your immune system is lower, because they're trying to fight the cancer. And chemo, it not only attacks the good cells, but it attacks the bad cells as well. Also, diabetes, type 1 and 2, smoking, because smoking constricts your blood vessel. It also leads to other problems like heart problems and lung problems. So smoking is a risk. Pregnancy and obesity. Obesity is a huge risk. So I do demonstrate some easy motion exercises at the end of the show. So please stay on for that, so you can have some exercises that you can do to help you lose weight. Now, for children, they can have what they call a multi-inflammatory syndrome. This is for children. This is a serious condition which it impacts several different organs of their body. The heart, the lungs, the blood vessels, kidneys, digestive system, brain, eyes, skin. The skin becomes very inflamed, very red and swollen. Evidence includes that many of these children were infected with the COVID virus that caused these type of symptoms. So there's proof of this, suggesting that the multi-symptom inflammatory syndrome, this is swelling and inflammation on all the organs I just mentioned, which is basically all the organs in your body that are important to keep your body function healthy. In children, their immune systems are related. When they do the blood test, they can see that they have developed those antibodies. So they know it's connected to the COVID. Possible signs and symptoms include fever in the last 24 hours or longer, vomiting, diarrhea, pain in the stomach. Now, you have to watch kids for symptoms. They pull on their ears with infection. They grab their abdomen like this and bend over when they have abdominal pain. So watch those nonverbal clues as well. skin rash, they have a rapid heartbeat. If they're really pounding, you can put your hand on their chest and you can feel it moving. Rapid breathing, red eyes, redness or swelling of the lips and tongue. You say it looks like a huge strawberry. That's how inflamed it is. That's terrible. So watch for that. Unusual tiredness, redness or swelling in the palms of their hands and feet. They get that redness and swelling. They get headaches. Kids typically don't get headaches. So if your child says my head hurts, please pay attention. Dizziness or lightheadedness in enlarged lymph nodes. Now there's a lot of lymph nodes right behind our ears and along our neck. There's lymph nodes. So if you feel it bulging out, then that tells you that their lymph nodes are swollen. That's what the doctor is doing when he's doing that like that. So check your children out very carefully. Now the warning signs for the multi-inflammatory syndrome when you need to go to the hospital. Difficulty breathing. Breathing is for everybody. If you can't breathe, then you need to go to 911. New confusion. They get bluish lips on their face. They get severe stomach pain. They're like doubling over, and they may be whining or crying. So that's why I said you have to watch your kids for those nonverbal symptoms. Now, if your child shows any of those symptoms and severe illness and signs of symptoms, you need to take them to the emergency room. Call 911. Don't worry about the COVID. They will protect your children. They will protect you as well. Just go. Don't wait. Some parents have waited and the child has died. So you don't want to wait. When they have this, is very important. It takes children out very quickly. So you need to watch them. Now, research also suggests that disproportionately higher rates of COVID is impacting the Hispanic and non-Hispanic black children and in non-Hispanic white children. So that's nothing new, right? We all have these same disparity, brown and black people. So watch your children. According to the health news from the NPR website, the mission has become even more urgent for the corona variants emerged around the world, raising concerns that the virus could invade our efforts to control it. If the spread is crucial, it could change very quickly. That's why we have to be vigilant. Since the vaccine distribution beginning in U.S. on December 14th, more than 101.1 million have received their vaccination. Now, across the U.S., that's 19.9%. Now, remember, they said that we have to have like at least 70% before we're all totally immune. But it's still new. So we're not sure yet. Populations, this is based on the CDC website that collects when all these people are getting their immunizations. We're still on the push, so when it's time, you guys get your immunization. Now, per the CDC guidelines, when you've been fully vaccinated, I don't totally believe that we should all be going out there and start going indoors with people outside our home, but I have to give you the standards just in case you do that so you can stay safe. Now, this is after you have been fully vaccinated. You will still have to learn. See, they're still learning how the COVID is spreading. So this is some information after you've been fully vaccinated. Take the precautions in public by wearing a mask. The same stuff we had before. You still need to do the same thing. 2 masks are better. Wear a K95 if you have it, and then a cloth mask over it. And keep your distance. It recommends at least a minimum of 6 feet. I think you should be as far apart as you can because the virus can travel 22 feet in less than 90 seconds. So you have to really be careful. Avoid crowds and poorly ventilated indoor ventilated spaces until you know more. So you don't want to be going up in places that have an enclosed environment. What changed if you've been fully vaccinated? You can gather indoors with fully vaccinated people without wearing a mask. That's like one group of family members and another group of family members that's fully vaccinated. Remember that, fully vaccinated. You can gather indoors with unvaccinated people from one household, for example, visiting with relatives who are living together without masks, unless any of those people or anyone that lives in that area has an increased risk of severe illness. Meaning, if they have all those diagnoses I mentioned to you, if they're 65 and older, then you shouldn't do those things. If you've been around someone who has COVID-19, you do not need to stay away from others or get tested unless you have symptoms. This is fully vaccinated. Remember that, fully vaccinated. However, if you live in a group setting like correctional or detention facility or group homes and are around someone who has COVID-19, you should still stay away from others for 14 days and get tested, even if you don't have symptoms. That means if you're living like in nursing homes or assisted living or long-term facilities, correctional facilities, you live there every day. You congregate together, you share bathrooms, and you share eating areas, common eating areas. What hasn't changed for now? If you've been fully vaccinated, you still should take the steps to protect yourself and others in many situations, like wearing your mask, staying at least 6 feet apart from others, and avoiding crowds and poorly ventilated places. Now, if you go into a place and there's no air conditioning there, then you need to leave, because it's not pulling any of the air out, it's not thinning it, and it's not circulating. So that virus is just going to stay there and not move. So that is not a safe thing for you. Take these precautions whenever you are in public gathering with unvaccinated people from more than one household. Visiting an unvaccinated person who is at increased risk to severe illness or death of COVID-19, or who lives with a person with increased risk. You should still avoid medium or large size gatherings. Now, I know these young ones, it's unfortunate we can't vaccinate them sooner, because they're the ones that go out and have all these parties with people, and they want to run out there, and then they're not protected. So please tell your teens and your young adults to still protect themselves and don't gather with medium or large gatherings. You should still delay domestic and international travel. It's not time for you to jump on a plane. If you can postpone it, postpone it. If you do travel, you still need to follow the CDC requirements and recommendation, meaning wearing your mask. I recommend you wear your goggles too. I've been talking about goggles for months because it can enter into the eye, in the conjunctiva. So I would suggest that as well. You should still watch out for symptoms of COVID-19, especially if you've been around someone who's sick. Always ask before you go to even a family member's location with one other household, is anybody sick? If anybody, I mean everybody in that household. If somebody's sick, then you should not go. You have to cancel your plan. If you have symptoms of COVID, you should get tested and stay home and away from others. I know you want to see your loved ones, but you have to ask the questions if they're sick. You will still need to follow guidance at your workplace. Where we go to work, you still got to follow those guidance. Wearing your mask, you're 6 feet apart, you're washing your hands frequently, and that's for everybody. Wash, 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 wash. If you're using the waterless soap, you have to make sure it's at least 60%. In most employee settings, it is, because they have to follow the guidelines. It's very important that you make sure you keep moving and washing your hands until the waterless soap has dried. Don't put it on and just rub and then wipe your hands on your clothes. That's not good. Wipe it until it dries. Now, what you need to know, and what we're still learning, because remember, this is a new virus, so we're still learning. We know that coronavirus 19 vaccines are effective in preventing disease, especially severe illness and death. And that's the key. Severe illness and death. You still may get it, but you won't be severely ill and possibly die. So that's very important. We're still learning how effective the vaccines are against variants of the viruses, different changes, different mutations of the viruses that cause the COVID. Early data shows that vaccines may work against some variants, but could be least effective against others. So we're still working on collecting that data because we don't know yet. That's why you still have to use your protective guidance. We know that other prevention steps help stop the spread like COVID, and the steps are still important even if you are vaccinated. Remember, I told you, you still got to wear protection and protect yourself. We're still learning how well COVID-19 vaccine keeps people from spreading disease. Remember, we had people who were asymptomatic that was spreading the disease and they didn't know they had it. So we're still trying to figure out how this impacts the vaccine, how, if it keeps you from spreading it or not. So we're still collecting the information. We're still learning. Early data shows that vaccines may keep people from spreading COVID-19, but we are learning more and more when people get vaccinated. So trust me, it's an ongoing study. It's ongoing collecting of data. We're still learning how long COVID vaccines can protect people. As you know, more CDC will continue to update us on recommendations for both the vaccine and the unvaccinated population. Different COVID-19s. We have 3 right now. We have the Pfizer, we have the Moderna, and the new one is Johnson & Johnson and Janssen. So none of the vaccines have eggs, they have preservative or latex in them. None of them. Okay, that's a good thing. So if you have allergies to that, you don't have to worry about that. You won't have any allergies to Pfizer, Moderna, or Johnson & Johnson. Now, with Pfizer, it takes 2 shots and 21 days in between. With the Moderna, it's 2 shots with 28 days in between. Now, both contain the mRNA vaccine protein. It's a new type of vaccine that protects against infectious disease. What it does is it triggers your immune response to activate antibiotics so your body can have those protective agents in your body in case you get exposed to it. Not in our vaccines. Instead, they teach our cells how to make proteins, or even just a piece of a protein that triggers an immune response inside our body. That immune response, which produces antibodies, what protects us from getting infected with the real virus when, in case it does enter our bodies. So that's what the mRNA does. In clinical trials, some side effects happen within 7 days of getting the vaccine and coming to some mild to moderate symptoms. Some side effects like fever, chill, tiredness, and headaches. You also get painful sore arm at the injection site. After my first one, I think about the 3rd day of Pfizer, I had a little nausea because it was spicy food. But if I stayed away from spicy food, I didn't have any problem. Everybody's different. Now, and also throughout the body, there's common things that happen after the 2nd dose of the vaccine. Most side effects was mild to moderate. It depends on the person. However, a small number of people had severe side effects, defining as affecting a person's ability to do daily living. Because you were feeling tired, you might have got a fever. So, when you have a fever, your body it takes energy from you. So you want to take the Tylenol or ibuprofen to control your fever if you get a fever. I didn't get a fever. Data also suggests that people who get the Pfizer vaccine were less likely to have more serious outcomes compared to people who got the saline placebo. They have 2 groups when they do research. They give the people the actual drug, and then they give the other set of the people placebo, which is only saline. Okay, but they don't know that. Only reason for not getting a vaccine: if you had a severe allergic reaction, they call it anaphylactic, or an immediate allergic reaction, even if it's not severe, to any of the ingredients of the mRNA COVID vaccine, such as the polyethylene glycol, you should not get the mRNA COVID vaccine. Again, this is anaphylactic reaction, severe, sometimes life-threatening allergic reactions that occur in minutes and sometimes several hours after getting the exposure. Allergens, and sometimes it's also called anaphylactic shock. Now, you don't have to know if you ever got this because you would know because you got severe symptoms and they had to give you epinephrine and send you to the hospital and you almost died. So you know if you had anaphylactic shock. I was reluctant at first because I had severe allergies to cats, but it's not the same thing. It was not anaphylactic shock. So I was cleared to get my vaccine. They watched me for 30 minutes in observation after my vaccine. So you just have to be honest with them, but don't worry because you have other allergies. If you have not used an EpiPen, which is epinephrine, then you don't have to worry about any allergic responses. But if you have concerns, talk to your doctor and your doctor will walk you through it. Okay, so then the Johnson & Johnson vaccine. Now this one is a vaccine, it's one shot, and it has a viral vector in the vaccine, which is a moderate version of a different virus, the vector, which is the vector, to deliver important instructions to our cell. So it's not the COVID virus, it's a different type of virus that they used in their products for the Johnson & Johnson. Now, I have to reiterate that this does not cause COVID. So don't panic thinking it's going to cause COVID because it won't. It's a harmless virus. It'll enter the cells into your body and then use the cell machinery to produce a harmless piece of the virus that causes COVID-19. That's the protein piece. This piece is known as the spike protein. Those ugly little spikes that you see that's sticking out of this like ball, that's the spike protein. And is only found on the surface of the virus that causes COVID. The cells display the spike protein on the surface, and our immune system recognizes it, and it doesn't belong there. This triggers our immune system to begin producing antibodies and activating other immune cells to fight off what it thinks is an infection. That's what our body normally does. At the end of the process, our body learns how to protect us against future infections with the virus that causes COVID-19. The benefit is that we get this protection from a vaccine without ever having to risk serious consequences of getting sick with COVID-19. Any temporary discomfort experienced after getting the vaccine is a natural part of the process and indicates that the vaccine is working. So if you're getting some slight reaction, like I mentioned earlier, then that means that your body is working. The vaccine is working. Facts about the COVID-19 viral vector vaccine. They cannot give someone COVID-19 or any other infection. Viral vectors cannot cause infection of COVID-19 or with the virus used as a vaccine vector. They do not interact with the DNA of your body in any way. So it's not changing your DNA structure. It's not doing anything to disturb that. The genetic material delivered by the viral vector does not integrate into your own DNA. How to protect yourself and others once you get vaccinated. Authorized from the COVID vaccine can help protect you from COVID. It's important to get the vaccine. You should get a COVID vaccine when it is available to you. Once you are fully vaccinated, you may be eligible to start doing some things that you had to stop doing when the pandemic started. You know, like giving grandma a hug. But grandma has to be fully vaccinated, and so do you. You need to continue to wear your mask. Anybody children that are 2 years and older can wear a mask. And again, I recommend you wear 2. Even if you have your K95 or your non-medical mask, put over another cloth mask over the top. It'll help protect you because some of those masks, there's openings on the side so the virus can still get in. So you want to make sure it's close onto your face. You also make sure you keep your distance at least a minimum of 6 feet apart around people who don't live with you. If someone in your household is infected, people in your household should take precaution, including wearing a mask to avoid spread to others. They should quarantine themselves. They should use one primary bathroom, and everybody else should use another one. If that's not possible, make sure that person, when they go in there, they spray the Lysol or some disinfectant to kill the air that's in the bathroom where they are. You must wash your hands frequently or use hand sanitizer before putting on your mask. So you don't want to contaminate your mask before you put it on. You want to make sure you wash your hands before you put it on, and make sure you wash your hands before you take it off when you come back to home, okay? Wear your mask over your nose. I see so many people wearing their masks under their nose. Cover your nose and your mouth. Make sure that it's secure under your chin. So it should be under your chin and over your nose. That's the way your mask should properly fit. Okay, so you have your mask, you put it on, right? So it should be, and if it's a K95, then they have this bridge here. So make sure you push together like this to make sure it's tightly fit. And it covers my nose and my mouth, and it's under my chin. Now, the little ones that are non-medical, they have a little bridge you can adjust as well. So do the same thing, tighten here, but if you notice on the side, there's some little gaps there. So that's why it's important to wear another mask over it to make sure that you're covered good. You can wear a cloth mask over it. You want to make sure it tightly fits so there's no gaps. So that's why the recommendation is for 2 masks. So that's why we have that. You want a tight fit. Cover your nose as well. Fit the mask snugly as I showed on the sides. If you have continued adjustment of the mask, then that mask is not fitting you properly. You need to get a different mask or a different brand. Like if you have to keep adjusting it because when you talk it moves and you got to put it back up, then you need a different mask because that mask doesn't fit you properly. Make sure you can breathe easily. Now, effective February the 2nd this year, masks are required on planes, buses, trains, and other forms of public transportation. Traveling into, within, or out of the United States. But remember, CDC does not recommend domestic or international travel at this time. But those of you who are going to travel, protect yourself. Transportation hubs are like airports and stations and stuff like that. Wear your mask, stay 6 feet away, get you some gargles. You want to make sure you wear this for eye protection as well. You want to make sure that they fit you, and then also you want to get the kind that is not vented because you want that side protection in your eyes. Okay, so we're going to take a break, and we'll be back in a few minutes. Okay, I'll see you in a few. good. Huh? Closer? Okay, hi and welcome back. So I'm going to show you some easy motion exercises that you can do in your couch while you're lying down, sitting, or standing. So for your stomach, if you're new to this, then put your back up against your couch and you always hold your abs in no matter which exercise you do. And then you can go up and down, right, and down. And then you can scoot down when you get more advanced, or if it's need to be harder. Always hold your abs in. And then more advanced, scoot all the way down, right? Hold your ab in and come up with your arms to do sit-ups. So, let's finish some stuff that we can do lying down. Okay, so if you're not used to exercising, and you can use resistant bands to help you, like you can help pull your leg up or exercises. For you guys who are not used to exercising, you can use it to help pull your leg up if you need it, right? If not, then you just move it up and down. Then you can do them together, or your ab in, you can do them together. Now, you can also, since we're here, you can bend your knees, put your palm of your hand down, and do some lifts. Now, you can either hold for 30 seconds or 3 sets of 10s. That's just the starting point. When you get more advanced, then you can do better. Now, when you get a little bit more advanced, you can hold yourself up and then slowly lower your feet. So in the meantime, you're keeping that ab tight and you're developing your core to be stronger, right? So that's when you get a little bit stronger. Took me a while before I got there, but you can get there too. Now, also, you can do the scissors, hold your abs in, right? You can do leg lifts. If you're just starting, do a little bit until you can go higher and higher and higher and higher. Okay, so that just depends on your beginning level and how strong you are. Now, Once you get really good, you build up more resistance, then you can go down very slowly when you're going down, holding your abs in. Okay, so you can do that. Now, another thing you can do, you can put the resistance band also on your legs to put more resistance. You can lay down on your side, and remember, it's both sides. I'm just demonstrating one side, but you should do both sides. So make sure that I usually put my hand here so I can make sure my hips are rolled over automatically. You can lift, and you can hold for 30 or 3 sets of 10, and then you can also straighten it out, and you can go 3 sets of 10 here, and then you can go back here, 3 sets of 10s. It's good for that lateral part of that leg, that thigh, right? And remember, do it on both sides. Now, another thing you can do, you can turn over on your side and make sure that you're over. And what you can do is you can lift your leg, your heels. If you can't go that far because of knee pain, you can go where you can go. It works that back thigh, buttocks, and the lower back until you can go all the way up. Right? Then when you get more advanced, you can cross your leg at the ankle to provide more weight when you're doing that. And then you can switch it. Right? That's more weight, more resistance that you can do. Okay? But that's when you get more advanced. 3 sets of 10s. Okay? Now, let's do some exercises that you can do while you're standing. So, while you're standing, you need to get a stronger core in your abs, your buttocks, and your thighs help as well. So what you can do is, if you're not used to it, get you an object, use a dresser or something high that you can hold on to. So you can hold yourself without, lift one leg and hold yourself up for at least 30 seconds. And then switch and do the other side, the same thing. Now, if you're not used to doing it, you might have to hold on to something, but just keep trying it and go as long as you can go to get through the process. Now, another thing you can do is side leg lift, right? So you just lift. If you got to lift low, then medium, then high, right? Low, medium, high. Wherever you can go, and then do both sides. Both sides. Now, another thing you can do is squats. Now, squats are good for you guys. If you have knee problems, then what you have to do is make sure when you do your squat, it's like a sit-down squat. Meaning you put your butt down like this to sit down, because that takes the pressure off your knee, right? So you push your butt and squat. If you don't have problems, then you can do your regular squat. Feet apart, and you can go down. If you can't go all the way, go where you can go until you can get to a lower part, and then until you can go all the way. But you have to practice that. So just practice it, and that's at least a start. Now, I talked about also, we got to build this core, right? Our abs. So, if you have back problems, then you need to do this slowly. Because if you go too fast, you get back spasms. I know, because I have back problems. So, you're going to go down and try to touch the floor. Touch the floor, right? If you can't go all the way, then you can go to your knees. You can go to your calves, your ankles, top of your foot, until you get to the bottom. This is a good warm down move as well. Just sit here and hold it here. It stretches your back out. Now, we want to mix it up. So we want to go to the side, right? For the love handles on the side. So, go to the side. You can go to the middle. And see, you notice you're opening and closing your arms at the same time. So you're moving your arms. Okay? This is what you're doing. So this is what you do. Hold your abs in every time you do that. Now, another thing you can do, you can get you some weights and you can march. Moving your arms, move in place. You can go higher, right? You can do that. All right. Now, if you don't have the weights, well, that's okay. You can get a water bottle. You can get some canned fruit, whatever. The point is to get them moving, right? That's all that matters, is that you move. Okay. Now, another thing I want to show you, we're going to do some stuff you do while you're sitting. So while you're sitting, this is actually standing to sitting. So let's do the last one from standing to sitting. You can do squats when you sit down, right? You're sitting in your chair and you're standing up. So those are squats. So if you need a little support when you're doing your squats, you can do that. And you can raise your chair at different levels to help support you to get you through the squats. So you can do that too, right? Working your arms. You can do this at work when you take a break. These are squats. But it's giving you support with the chair. So you want to make sure that the chair isn't moving and can't move so you don't fall. Okay? So it's very important. Now, another thing you can do, and also you can do that while you're lying as well, is you can bend your knees, open your legs apart, and work this inner thigh. You can do it while you're lying down, and you can do it while you're sitting. Just open and close, right? So this is for here. So you can do that whether you're lying or whether you're sitting. So that's an exercise you can do. Now, you can also do, your toe marches, right? By lifting your feet, and you can be doing individual, you can do them together. It's up to you. You can rotate your arms to work that as well. Or you can do them together with your weights. You can do that. Now, you can also do lifts while you're sitting here. You can lift. So you can lift up, depending on where you are. Lift, low, medium, high. Depends on where you are, right? But you can lift. This is definitely for the job. Definitely. And you can feel it. Remember, hold your abs in every time. 3 sets of 10, or unless you can do more. Because you're going to feel it, so don't think you won't. You will feel this. You can also do the standard scissors while you're sitting, just like you can do it while you're lying, right? Now, you can also do 3 points where you lift up, straighten it out, bend it back, and you put it down. So lift up, straighten it out, bend it back, and put it down. Lift up, straighten it out, bend it back, put it down. So remember, it's for both sides of your body. At least 3 sets of 10s, right? So the other things you can do lifts. Lift both your legs up. Can't do both, then you can do the one, right? I showed you those. You can do one leg, or you can do both. You can lift. This is really good for that, the whole abdomen. So you can do little lifts, big lifts, medium lifts, and big lifts, right? So you're holding your ab in as you're doing it, right? So you can do that. 3 sets of 10, or count of 30. It's up to you. Now, if you want to do isometrics and you want to hold it, you can do that too. You can hold it. Same thing when you're sitting. You can hold your abs in, hold it for 30 seconds, let it go, or you can in and out, in and out, in and out. But if it's isometric, you're holding it, right? So you can try that as well. Holding it for 30 seconds. Not holding your breath, but holding your absence. Okay? Now, there's more exercise you can do for your arms. You can resist the band and tie it off. Put your hands in there. You put one on your knee, and then you can pump the other one, right? Same thing for the other one. You can pump, and you can do curls, right? Now, if you don't have any shoulder problems, then you can do other ones. Hold on, let's finish this one. Let's do also up. You can put it up for the back part of that arm. This one, right? You do that. Now, my son, he trains, and he tells me that I'm not doing good if I don't extend my arm all the way down, right? So if you are having shoulder problems, you may not be able to do that. But the best way to get full benefit from your arm is to extend it down, like so. Remember, you rotate. You want to do both sides. So you extend your arm down all the way. That gives you the full benefit of that curl. Now, if you're not able to do it, then you can modify it by just going here. And if you need support, then you put your elbow in the back upper part, on the lateral side of your hip, and then you can pump it this way. Whichever way is okay for you to tolerate. And your body will tell you, because it will give you some pain. It'll tell you what's going on, right? Now, another thing I want to tell you about is a peddler. And this is my QB. My QB, it has a speedometer on it, so it tells you how many steps and how far you go. It also has a resistive dial that you can adjust to make it harder. And you know, while you're watching Power, I can't wait till it comes back on, or, Queen Sugar, Black and Black, you can be doing your exercise. You can pump your arm while you're pedaling, and do it with your favorite TV show. There's several commercials that go by then you've done like 30 minutes, and before you know it, you've done a whole hour. Wow, right? A whole hour. Now you can also rotate it going backwards, so you get the benefit of going backwards as well as forward. So this is exercise that you can fit in any day. And even if you're tired, I guarantee you, if you exercise, you will still feel better. So don't make any excuses. Wait till at least 45 minutes after you eat and start exercising. You need to get the move. Remember, obesity is a big risk factor. Now, another thing I wanted to tell you guys is you want to make sure that you're building your immune system. So you need these products to help build your immune system. Like almonds are great. Cashews are a great source as well. Avocados, broccoli, blackberries, those are all great sources of fiber. Zinc for building up your immune system. Okay, so again, that's the cashews, the almonds, the blackberries, and then for the berries, you can wash them and then freeze them, and then you can take them out when you need them, because if you don't use berries right away, they spoil, right? So, and who wants to waste all that money? You can get your berries on any line, on groceries. You don't have to be in it, but now you can order online. Get the berries, clean them, freeze them, and take them out when you need them. Also, you want to make sure that, if you can't get those products, or you don't like those products, there's garlic that helps with your immune system, supplements you can get, and then there's also zinc products that you can get and take as well. Make sure if you're taking the zinc, you take it at dinner time, because otherwise it makes you nauseous. So you never want to take it on the easy side. Also, the great old vitamin C, and then we know about vitamin D. That's good for us as well. This is calcium with D. Usually D helps to pick up the calcium, so that's a great thing for your bones as well. But it helps to build the immune system. Turmeric is good as well. It also helps with swelling, so it's an anti-inflammatory. So turmeric is good for that as well. Now, also, coronavirus does not like acid. It hates it. So you can eat things that are acid products like lemons, limes, there's oranges, there's pineapples, and guess what? Avocados. Avocado is a good zinc as well as a good acid product. So avocados is both. So avocado is my new favorite vegetable because it does so much. Now, if you're having problems sleeping at night, then you can get some melatonin. Take it about an hour before you want to actually go to sleep, and you should be able to sleep. This one is 10 milligrams. So this is what I take to help me with sleep, because you want to make sure you get enough rest, because when you're sleeping is when your immune system is rebooting. It reboots when you sleep. So if you're not getting enough sleep, you're not giving your body enough time to reboot. So you need to do those things. Remember, continue to wash your products, what you bring it in from stores or even the mail. You want to make sure you wash your hand, wash your packages. Be mindful of your phone. You touch that, they say research is more than 250 times a day. So you want to be careful. Make sure you clean your phone, your cell phone. Make sure you're cleaning, wiping down with antibacterial soap, or spraying frequent touch areas like knobs and doors, cabinets, and kitchens, especially in bathrooms. Those are frequently touched areas. You want to make sure you keep those clean within the house, especially if someone's sick and they're in one area. You definitely want to keep that clean. You want to wipe that down. Also, the good old thing like money. Money is very nasty. Can you imagine how many times someone touched this money? And you can wash your money. You can wash it. So we know that from watching all the criminal movies. They wash their money all the time. So you can't wash your money. So I just want you to be mindful of that. And also, if the coronavirus doesn't like mouthwash either, so there's research that proves that if you gargle every morning, so when you get up, just do a little cough, get some stuff up if there is anything there, and then gargle. Gargle helps. Coronavirus does not like mouthwash. Doesn't matter which one you get, it just don't like it. You can also make your own bleach by getting a container, a little bottle, plastic bottle. You can order them online. It's only 1/3, so you put 1/3 bleach and the rest is water, and you have your bleach spray. And it's cheaper because you can buy a big jug and get you a couple of bottles that'll last you forever, right? So you can do that. Now, also for clearing your sinuses, if you've been out a long time during the day, there's Netimed. You put your little package in there with warm water. I recommend warm water because cold water is not pleasant. And you follow the instructions. Fill it to the line, 1 pack. And then you hold your nose over the bathroom and you squirt it, and you can clean out your sinuses. And it works really well. It really does. When you gotta get comfortable using it though. But once you start, just force yourself to get through it, and then you'll be okay. And then keep using it, because then you sneeze and you get all this dirt out of your sinuses and your nose, because it's all connected. Your sinuses, your nose, your throat, it's all connected. That's why they say ENT, ears, nose, and throat. It's all connected in the same system. So if you want to clean it out, those are some of the things that you can do. Now, I know you're getting tired or not being around with your friends and family. I gave you some guidance on what you should do once you're fully vaccinated, and who's not vaccinated. Especially people who are not vaccinated, you have to really be careful. But even if you're fully vaccinated, if it's another one household, then you can, and they're not sick, they're not at high risk, being 65 or older, or have any underlying medical condition, then you can gather in your home. But try to space yourself as much as you can. Before you go to a family member's home, make sure you ask if anyone is sick. I mean, everyone in the household. Sometimes there's households with 10 family members. You got to ask everybody if they're sick. That's what you got to ask before you go over there. Or don't go at all. Not if they're sick. Don't gather. Remember, wear your mask, wear 2 masks, wear your goggles, keep more than 6 feet apart, wash your hands frequently. You can reach me at Markeitha, my website, at healthyliving.company. There, if you missed the live show, you can watch anytime by clicking on the previous shows. You can watch anytime with your friends and your family. I have different products there, Keita's Egg Toast and Gumbo. Send me a message, what you want. You can also contact me here at the Next Level Studios at 310-549-1113. 310-549-1113. The producer of the show is T-Jam, T-J-A-M-C. I'm at tjamsmusic.com. There he has a list of songs that he has produced. Contact him there. He also does website. Contact him at the Next Level Studios at 310-549-1113. 310-549-1113. Stay safe. Just keep doing the suggestions to protect yourself and your family. And I'll see you in a couple of weeks. Okay?